Question 1. A client with type 1 diabetes is confused diaphoretic and has a capillary glucose of 64 milligrams per deciliter. The client is NPO for surgery in 30 minutes. Which action should the nurse take first? A. Give 15 g oral glucose gel. B. Administer 25 milliliters of 50% dextrose IV.C. Hold all insulin and recheck in 1 hour. D. Notify anesthesia to cancel surgery. Answer. B. Administer 25 milliliters of 50% dextrose IV. Rationale. The client is symptomatic and NPO. IV dextrose is the safest rapid correction. Oral glucose is unsafe due to aspiration risk. Rechecking delays treatment. Surgery may proceed once stabilized. Question 2. A client with suspected primary hypothyroidism has TSH 18 milli international units per liter, free T4 low, sodium 128 milliequivalent per liter, heart rate 54 per minute. Which prescription should the nurse question? A. Start levothyroxine 25 micrograms daily. B. Administer propranolol 40 milligrams. C. Place client on fall precautions. D. Monitor for ileus. Answer. B. Administer propranolol 40 milligrams. Rationale. Beta blockers are used in hyperthyroidism, not hypothyroidism with bradycardia. This could worsen low heart rate. Other actions are appropriate. Question 3. A client with DKA is receiving IV insulin. Which findings require the nurse to stop the infusion and notify the provider? Select all that apply. A. Potassium 3.1 milliequivalent per liter. B. Glucose drop from 420 then 250 in 1 heart rate. C. New onset PT waves. D. Serum bicarbonate 16 milliequivalent per liter. Answer. A. Potassium 3.1 milliequivalent per liter. C. New onset PT waves. Rationale. Insulin drives potassium into cells, hypocalcemia, less than 3.3, or ECG changes require stopping insulin and replacing potassium plus. Rapid glucose fall is acceptable. Low bicarbonate is expected in DKA. Question 4. A client on chronic prednisone develops fever and productive cough. Which instruction by the nurse is most critical? A. Double the prednisone dose today. B. Take an antipyretic and rest. C. Stop prednisone until fever resolves. D. Increase dietary potassium. Answer. A. Double the prednisone dose today. Rationale. During stress or infection, steroid doses must be increased to prevent adrenal crisis. Stopping the drug is dangerous. Question 5. A client receiving metformin is scheduled for a CT scan with IV contrast tomorrow. The nurse should hold today's metformin dose? A. True. B. False. Answer. A. True. Rationale. Metformin is withheld before contrast to prevent lactic acidosis if renal function declines. Question 6. A client with Addison disease reports vomiting and dizziness. Vital sign. Blood pressure 86/50, heart rate 122, sodium 129, potassium 5.9. Which prescription is the priority? A. Administer oral hydrocortisone. B. Start 0.9% saline IV bolus. C. Give potassium escalate PO. D. Restrict sodium intake. Answer. B. Start 0.9% saline IV bolus. Rationale. Adrenal crisis causes shock and hyperkalemia. Rapid isotonic fluids are life-saving before oral meds. Sodium should be increased, not restricted. Question 7. The nurse prepares to mix insulins, 10 units regular and 20 units NPH. The nurse should draw up NPH first? A. Yes. B. No. Answer. B. No. Rationale, regular clear, is drawn first to prevent NPH contamination and dosing error. Question 8. A client with Graves' disease suddenly develops 103.8 degrees Fahrenheit fever, agitation, and heart rate 142 per minute. Which action is priority? A. Give acetaminophen. B. Administer propranolol IV. C. Obtain thyroid panel. D. Provide high-calorie diet. Answer. B. Administer propranolol IV. Rationale. This is thyroid storm. Beta blocker to control cardiac effects is priority over diagnostics or diet. Question 9. A client using insulin glargine is being discharged. Which statements require immediate correction? Select all that apply. A. I can mix glargine with my Lispro in one syringe. B. I will take glargine at the same time daily. C. If my sugar is high, I can double glargine. D. I will inject it only in my abdomen. Answer. A. I can mix glargine with my Lispro in one syringe. C. If my sugar is high, I can double glargine. Rationale. Glargine must never be mixed, and doses are not adjusted acutely. Doubling risks severe hypoglycemia. Timing consistency is correct. Sites may vary. Question 10. A client with Cushing syndrome has potassium 3.0, glucose 260, blood pressure 168/94. Which task should the nurse delegate to the LPN? A. Assess for signs of infection. B. Administer IV potassium replacement. C. Educate about glucose monitoring. D. Evaluate ECG for U waves. Answer. B. Administer IV potassium replacement. Rationale. IV potassium administration is within LPN scope after assessment. RN must assess, teach, and interpret ECG. Question 11. A client with type 2 diabetes on metformin and glipizide presents with vomiting x24 heart rate, dizziness, and tachycardia. BG 48 mg per deciliter, blood pressure 86/52, heart rate 118. Which action should the nurse take first? A. Administer 25 milliliters, 50% dextrose, IV. B. Hold glipizide and monitor. C. Start IV 0.9% NS bolus. D. Give oral glucose. Answer. A. Administer 25 milliliters, 50% dextrose, IV. Rationale. Symptomatic severe hypoglycemia is life-threatening. IV dextrose is priority over fluids or holding meds. Tachycardia and hypotension require ongoing monitoring, but are secondary to hypoglycemia. Question 12. A client with SIAD has sodium 118 milliequivalent per liter, confusion, and seizure activity. Which action is priority? A. Initiate seizure precautions. B. Restrict fluids. C. Administer hypertonic saline slowly. D. Encourage oral sodium. Answer. C. Administer hypertonic saline slowly. Rationale. Symptomatic severe hyponatremia is life-threatening. Slow 3% saline corrects sodium. Seizure precautions are important, but secondary to correcting sodium. Fluid restriction is delayed due to emergent symptoms. Question 13. Which findings indicate impending myxedema coma? Select all that apply. A. Hypothermia 95° FB. Bradycardia 46 per minute. C. Hypoventilation respiratory rate 8. D. Hyperreflexia. Answer. A. Hypothermia 95° Fahrenheit. B. Bradycardia 46 per minute. C. Hypoventilation respiratory rate 8. Rationale. Severe hypothyroidism slows all metabolic processes. Hyperreflexia is hyperthyroid sign, not hypothyroid. Question 14. A client receiving IV hydrocortisone for adrenal crisis develops BG 280, potassium 3.1, blood pressure 84/50. Which intervention is most critical? A. Administer insulin, IVB. Begin IV potassium replacement. C. Increase hydrocortisone. D. Rapid IV fluid bolus. Answer. D. Rapid IV fluid bolus. Rationale. Hypotension/shock is priority. Potassium replacement follows fluid resuscitation. Insulin is inappropriate. BG is expected due to steroids. Question 15. Levothyroxine should be administered with breakfast. For a newly diagnosed hypothyroid client? A. True. B. False. Answer. B. False. Rationale. Levothyroxine is absorbed best on an empty stomach 30 to 60 minutes before food. Giving with food reduces efficacy. Question 16. A client in DKA, BG 520 then 320 after 1 heart rate IV insulin, potassium 3.0, pH 7.18. Which action is priority? A. Continue insulin only. B. Add dextrose IV. C. Hold insulin and give potassium IV. D. Administer sodium bicarb. Answer. C. Hold insulin and give potassium IV. Rationale. Insulin will worsen hypocalcemia and risk cardiac arrest. Potassium replacement is priority. Insulin is resumed once safe potassium level is reached. Question 17. Which client should the nurse see first on the endocrine unit? A. Addison's with sodium 128, potassium 5.2. B. Graves with heart rate 122, mild tremor. C. Post-thyroidectomy, tingling lips, carpopedal spasm. D. Diabetes A1C 9%. Answer. C. Post-thyroidectomy, tingling lips, carpopedal spasm. Rationale. Hypocalcemia can lead to laryngospasm. Airway or emergency management is priority. Question 18. Which instructions are critical for a client taking fludrocortisone? Select all that apply. A. Weigh daily. B. Increase salt intake. C. Avoid NSAIDs and licorice. D. Take with high potassium foods. Answer. A. Weigh daily. B. Increase salt intake. C. Avoid NSAIDs and licorice. Rationale. Fludrocortisone retains sodium/water. Weight monitoring and avoiding excess potassium-lowering products are potassiumy. High potassium is contraindicated. Question 19. A client with acromegaly presents with headache and visual changes. Which test is priority? A. Colonoscopy. B. MRI pituitary. C. Bone density scan. D. Thyroid panel. Answer. B. MRI pituitary. Rationale. Visual changes suggest pituitary tumor compression. Imaging is urgent. Cologne screening is routine, not emergent. Question 20. Non-selective beta blockers are safe for a client with thyroid storm and asthma? A. Yes. B. No. Answer. B. No. Rationale. Non-selective beta blockers risk bronchospasm. Consider esmolol or cardioselective alternatives. Question 21. A client with HHS. BG 980, sodium 150, serum osmolality 360, lethargic. Which is priority? A. IV insulin. B. Rapid IV fluids. C. Monitor for potassiumatosis. D. Oral glucose. Answer. B. Rapid IV fluids. Rationale. Severe dehydration is life-threatening. Insulin is given after fluids begin to avoid hypoperfusion. HHS often has minimal potassiumatosis. Question 22. Lab results for client on spironolactone. Potassium 5.8, sodium 138, blood pressure 126/78. Which action is priority? A. Administer spironolactone. B. Hold spironolactone and notify provider. C. Encourage high potassium foods. D. Document only. Answer. B. Hold spironolactone and notify provider. Rationale. Hyperkalemia is dangerous. Holding drug and notifying provider prevents cardiac complications. Question 23. Which signs indicate pheochromocytoma crisis? Select all that apply. A. Blood pressure 240/130. B. Severe headache. C. Profuse diaphoresis. D. Bradycardia. Answer. A. Blood pressure 240/130. B. Severe headache. C. Profuse diaphoresis. Rationale. Catecholamine surge produces hypertension, headache, diaphoresis. Bradycardia is atypical. Question 24. Before giving desmopressin for central DI, which assessment is most important? A. Serum sodium. B. Blood glucose. C. Potassium. D. Urine potassiumatones. Answer. A. Serum sodium. Rationale. Desmopressin increases water retention. Hyponatremia can develop quickly. Question 25. Metformin is safe in a client with eGFR 25 milliliters per minute? A. True. B. False. Answer. B. False. Rationale. Severe renal impairment increases risk for lactic acidosis. Metformin must be withheld. Question 26. Post-thyroidectomy, client has stridor, neck swelling, and anxiety. Which is first action? A. Give calcium gluconate. B. Elevate HOB. C. Prepare for intubation. D. Administer analgesic. Answer. C. Prepare for intubation. Rationale. Airway obstruction is life-threatening. Calcium addresses hypocalcemia, but airway is priority. Question 27. Which signs suggest chronic hypercortisolism? Select all that apply. A. Purple striae. B. Moon face. C. Proximal muscle weakness. D. Hyperkalemia. Answer. A. Purple striae. B. Moon face. C. Proximal muscle weakness. Rationale. Cushing causes hypokalemia, not hyperkalemia. The other signs reflect chronic cortisol excess. Question 28. Client on PTU reports fever and sore throat. What is priority? A. Acetaminophen. B. CBC. C. Fluids. D. Reassure. Answer. B. CBC. Rationale. PTU can cause agranulocytosis. Fever or sore throat requires immediate WBC check. Question 29. Best meal choice for hypoparathyroidism? A. Milk and cheese. B. Bran cereal. C. Spinach salad. D. Cola beverage. Answer. A. Milk and cheese. Rationale. High calcium, low phosphate diet is required. Bran, spinach, and cola are high in phosphate, which decreases calcium absorption. Question 30. The nurse should massage the neck dressing after thyroidectomy to prevent swelling? A. Yes. B. No. Answer. B. No. Rationale. Massage can disrupt sutures and cause hematoma. It is contraindicated post-thyroidectomy. Question 31. A 52-year-old client with type 1 diabetes reports sodiamusia, abdominal pain, and fruity breath. Vitals. Blood pressure 102/60, heart rate 118, respiratory rate 28. BG 460 mg per deciliter. Serum potassiumatones positive. What is the nurse's priority action? A. Give subcutaneous rapid-acting insulin. B. Initiate IV fluids and start IV insulin. C. Give oral glucose. D. Monitor urine output only. Answer. B. Initiate IV fluids and start IV insulin. Rationale. This is DKA. IV fluids restore perfusion, and insulin corrects hyperglycemia and potassiumatosis. Subcutaneous insulin is too slow. Oral glucose worsens hyperglycemia. Question 32. A client with Addison disease missed her morning dose of hydrocortisone and presents with dizziness, sodiamusia, and blood pressure 84/50. Which action is most urgent? A. Encourage oral fluids. B. Administer IV hydrocortisone. C. Monitor vital signs every hour. D. Hold all medications. Answer. B. Administer IV hydrocortisone. Rationale. Adrenal crisis is life-threatening. Replacement steroids are priority. Fluids may follow, but steroids are life-saving first. Question 33. Which findings in a client with hyperthyroidism indicate impending thyroid storm? Select all that apply. A. Fever 103 degrees Fahrenheit. B. Heart rate 142 per minute. C. Mild hand tremor. D. Diaphoresis. Answer. A. Fever 103 degrees Fahrenheit. B. Heart rate 142 per minute. D. Diaphoresis. Rationale. Severe tachycardia, hyperpyrexia, and sweating suggest thyroid storm. Tremor alone is not emergent. Question 34. A client with type 2 diabetes on metformin presents for routine labs. eGFR 28 milliliters per minute. Creatinine 2.1 milligrams per deciliter. Which action should the nurse take? A. Continue metformin and check labs in 3 months. B. Hold metformin and notify provider. C. Administer half-dose metformin. D. Switch to glipizide immediately. Answer. B. Hold metformin and notify provider. Rationale. Severe renal impairment increases lactic acidosis risk. Drug must be withheld and provider notified. Question 35. A 34-year-old post-thyroidectomy client reports tingling around mouth and fingers, carpopedal spasm, and anxiety. Which intervention is priority? A. Give calcium gluconate IV. B. Place in high Fowler's position. C. Encourage deep breathing. D. Apply cold compress. Answer. A. Give calcium gluconate IV. Rationale. Symptoms indicate acute hypocalcemia from parathyroid injury. IV calcium is life-saving. Airway positioning is secondary. Question 36. Which nursing actions are essential for a client receiving desmopressin for central diabetes insipidus? Select all that apply. A. Monitor serum sodium. B. Measure daily weight. C. Encourage unrestricted fluids. D. Check urine specific gravity. Answer. A. Monitor serum sodium. B. Measure daily weight. D. Check urine specific gravity. Rationale. Desmopressin can cause water retention and hyponatremia. Fluids must be controlled. Weight and urine output monitored. Question 37. A client with Cushing syndrome presents with blood pressure 178/102, potassium 3.0, and new onset edema. Which action should the nurse prioritize? A. Administer potassium supplement. B. Initiate antihypertensive therapy. C. Obtain daily weight and INO. D. Notify provider for hypernatremia and hypokalemia. Answer. D. Notify provider for hypernatremia and hypokalemia. Rationale. Electrolyte imbalance and hypertension are dangerous. Provider-directed management is needed before routine interventions. Question 38. A 45-year-old client with DKA on IV insulin develops potassium 2.9 milliequivalent per liter and peak T waves on ECG. What should the nurse do first? A. Increase insulin infusion. B. Administer IV potassium immediately. C. Continue fluids only. D. Give oral potassium. Answer. B. Administer IV potassium immediately. Rationale. Hypokalemia with ECG changes is life-threatening. Insulin should be held until potassium is corrected. Question 39. A client with pheochromocytoma reports severe headache, palpitations, and blood pressure 240/128. Which intervention is priority? A. Administer acetaminophen. B. Give IV labetalol as ordered. C. Obtain MRID. Encourage ambulation. Answer. B. Give IV labetalol as ordered. Rationale. Hypertensive crisis can cause stroke or MI. IV antihypertensive therapy is emergent. Question 40. Which dietary teaching is appropriate for a client with hypoparathyroidism? Select all that apply. A. Include calcium-rich foods like milk and cheese. B. Limit foods high in oxalates like spinach. C. Drink cola beverages freely. D. Use phosphate binders as prescribed. Answer. A. Include calcium-rich foods like milk and cheese. B. Limit foods high in oxalates like spinach. D. Use phosphate binders as prescribed. Rationale. High calcium, low phosphate diet prevents hypocalcemia. Colas increase phosphate and worsen imbalance. Question 41. A 28-year-old type 1 diabetic is admitted with vomiting, polyuria, and confusion. BG 540, potassium 3.2, pH 7.15, sodium 134, heart rate 124. Which is the priority nursing action? A. Start IV 0.9% NS bolus. B. Administer IV insulin immediately. C. Give oral potassium. D. Draw blood cultures. Answer. A. Start IV 0.9% NS bolus. Rationale. Hypovolemia and shock risk are highest priority. Insulin initiation is delayed until potassium greater than or equal to 3.3 to avoid cardiac arrest. Oral potassium is ineffective in acute crisis. Question 42. During DKA management, potassium falls to 2.8 milliequivalent per liter with PT waves. Which action must the nurse take first? A. Increase insulin fusion. B. Hold insulin and give IV potassium chloride. C. Give subcutaneous insulin. D. Monitor urine output. Answer. B. Hold insulin and give IV potassium chloride. Rationale. Insulin drives potassium intracellularly. Giving insulin now would worsen hypocalcemia and risk fatal arrhythmias. Question 43. A client post-thyroidectomy reports stridor, neck swelling, and perioral tingling. Place these interventions in priority order. 1. Prepare calcium gluconate IV. 2. Elevate HOB. 3. Prepare for intubation. 4. Monitor vital signs. A. 3 then 1 then 2 then 4. B. 1 then 2 then 3 then 4. C. 2 then 4 then 1 then 3. D. 4 then 2 then 1 then 3. Answer. A. 3 then 1 then 2 then 4. Rationale. Airway compromise is first priority, intubation, then acute hypocalcemia management, positioning, and routine monitoring. Question 44. Which findings indicate a client is progressing to thyroid storm? Select all that apply. A. Fever 104 degrees Fahrenheit. B. Heart rate 156 per minute. C. Mild tremor. D. Delirium. Answer. A. Fever 104 degrees Fahrenheit. B. Heart rate 156 per minute. D. Delirium. Rationale. Thyroid storm presents with hyperpyrexia, tachycardia, and CNS changes. Tremor alone is not emergent. Question 45. A client with Addison disease missed steroids and presents with hypotension, sodiamusia, and hyperkalemia. Which interventions should be done immediately? Select all that apply. A. Administer IV hydrocortisone. B. Start 0.9% NS IV bolus. C. Give potassium-restricted diet. D. Monitor daily weight. Answer. A. Administer IV hydrocortisone. B. Start 0.9% NS IV bolus. Rationale. Adrenal crisis requires urgent steroid replacement and fluid resuscitation. Diet and weight monitoring are supportive, not emergent. Question 46. A client with HHS. BG 950, sodium 148, serum osmolality 365, lethargic. What are the priority interventions? Select all that apply. A. Rapid IV 0.9% NSB. Start IV insulin. C. Administer oral potassium. D. Frequent neurochecks. Answer. A. Rapid IV 0.9% NS. B. Start IV insulin. D. Frequent neurochecks. Rationale. Rehydration first, then insulin after volume correction. Neuromonitoring for cerebral edema is critical. Oral potassium is not safe in severe hyperosmolar state. Question 47. Place these interventions for a client with DKA and severe hypocalcemia, K2.7 PT waves, in correct order. 1. IV insulin. 2. IV potassium. 3. Cardiac monitor. 4. IV fluids. A. 3 then 2 then 4 then 1. B. 2 then 3 then 4 then 1. C. 4 then 2 then 3 then 1. D. 3 then 4 then 2 then 1. Answer. A. 3 then 2 then 4 then 1. Rationale. Cardiac monitoring first, then potassium replacement, fluid resuscitation, and finally insulin after potassium safe. Question 48. A client with Cushing syndrome presents with blood pressure 182/108, potassium 3.0, sodium 150, edema. Which should the nurse do first? A. Administer potassium supplement. B. Notify provider for antihypertensive and electrolyte correction. C. Start daily weights. D. Encourage ambulation. Answer. B. Notify provider for antihypertensive and electrolyte correction. Rationale. Severe electrolyte imbalance and hypertension can be life-threatening. Provider-directed intervention is priority. Question 49. Which interventions are essential for a client with central diabetes insipidus? Select all that apply. A. Monitor serum sodium. B. Measure daily weight. C. Encourage unrestricted fluids. D. Check urine specific gravity. Answer. A. Monitor serum sodium. B. Measure daily weight. D. Check urine specific gravity. Rationale: desmopressin can cause water retention and hyponatremia. Fluid intake must be carefully monitored. Question 50. A client with pheochromocytoma has blood pressure 240/130, severe headache, and palpitations. What is the first nursing action? A. Administer acetaminophen. B. Administer IV antihypertensive as ordered. C. Prepare MRI. D. Encourage relaxation. Answer: B. Administer IV antihypertensive as ordered. Rationale: hypertensive crisis is life-threatening. Rapid blood pressure control is priority. Diagnostics and comfort measures are secondary. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.